Peripheral arterial disease really refers to a disease process by which the arteries, really anywhere in the body, become narrowed by a thickening in the wall of the artery. And that thickening is made up of normal cells in the artery wall, muscle cells, but also cholesterol and calcium and lipid deposits that are not normal. And then that abnormal thickening of the artery wall essentially narrows the blood flow channel of that artery. It's definitely a disease of aging population. High blood pressure, diabetes, high cholesterol, smoking is also a major cause. And then also there's genetic causes. There's gene mutation and gene problems that people inherit that make them more susceptible to peripheral arterial disease. The symptoms patients will have would depend on which artery is affected. Common ones that we see as vascular surgeons are blockages in the carotid artery in the neck, and those oftentimes present as a major stroke or what we call a mini stroke or a transient ischemic attack, where a patient will have paralysis or clumsiness in an arm or leg or a difficulty speaking for a short period of time, where with a major stroke that kind of a deficit occurs for hours or days. For blockages to the kidney artery, a lot of times it's uncontrolled high blood pressure or a change in a patient's usual blood pressure. When people get blockages to the legs or arms, then they usually have symptoms that we consider claudication. So initially when patients have blockages in their legs, they don't have pain at rest, but when they walk, their big muscle groups, the calf and the thigh, hurt because of a lack of blood flow. Once blood flow becomes even less, patients can start having pain in their toes and feet, even at rest and at night. And then the most severe symptoms we see with a lack of blood flow to the leg are toe and foot infections, and actually necrosis or tissue that dies in the toes or feet by a lack of blood flow. As vascular surgeons, we still do offer patients traditional bypass surgeries, and there are times because of the nature of a blockage or the nature of the artery the blockage is in, that we still will do a traditional open surgery. But most of our procedures now are what we call endovascular or minimally invasive. Over the last several years, the technology of angioplasty, some people call that a balloon, or stenting, has just come so far that with a lot of the arteries, including the carotid artery, kidney arteries, arteries to arms, arteries to legs, we are able to treat now with balloons and stents. We also have different types of atherectomy catheters, and kind of a commonplace term for that would be almost a roto-rooter. They are small blades that spin on a wire and essentially cut the blockage out of the inside of the artery and capture what you've cut out at the same time. We also have a laser that we can use on veins and arteries. So technology has just really exploded the last several years, and the exciting thing for us is it's allowed us to offer patients minimally invasive treatments for artery disease, vein disease, and even aneurysms now. We're able to repair most abdominal aortic aneurysms with stents. And it prevents a large incision and a lengthy hospitalization and severe complications of wound healing and infection that we just don't see when we're able to treat these diseases with a puncture and a catheter and a balloon or stent. One of the major advances for the patients with the minimally invasive techniques is they have much less complications. Most of these patients are able to go home the same day or at most spend one night in the hospital. And traditionally these patients would have been in the hospital 4 or 5 days. We typically tell these patients that we've done endovascular procedures on to go home and take it easy that evening, to just rest around the house. But by the next morning, we would almost always give them a thumbs up to resume essentially normal activities. And so that's been a huge benefit to the patient, to have less complications and be able to resume activities and recover much quicker than traditional surgery techniques.